This week we had our BDS Year 4 committee. If you want to find out what happened, stay tuned. Hello ladies and gentlemen, my name is Reza. I'm the Director of Undergraduate Education here at the School of Dentistry, University of Manchester, and you're watching one of your favorite YouTube channels, Manchester Molars. Thanks a lot for joining me on this episode, and I'm going to start that with a quick interview with Professor Allison, Qualtrough, BDS Year 4 lead, who just had their first BDS Year 4 committee this week. So please come and join me so we can find out how this meeting went. Hi Alison, thanks a lot for coming along to Manchester Molars. How are you today?
I'm good, thank you. Yes, are you? Are you good?
I'm very well, thank you very much. So Alison, yesterday you chaired the BDS Year 4 committee. Could you tell us a little bit about what this committee is all about? Because I assume this is a new thing for this year. And could you just give us a little bit of update, please?
Yes, thank you. Happy to do so. Although chair is a bit of a formal word, and I think really it was more a kind of general chat. I've done it before in the past, it's always worked quite well, so this year formalised it a little bit. So the concept is that there's a representative from each EBL group and we gather together. We're aiming on a monthly basis, and just to chat about how we can make life as straightforward and enjoyable for them. And I do appreciate their input because we can actually take action. So yeah, we met together and they had some good ideas. We talked about bits and pieces of things. The fourth years are very much enjoying assisting the fifth years, so that's that kind of starting clinical contact. And just a reminder to all the students that it's important that they do get fit tested, but they can still assist fifth year students by using hoods if they need to, if they've not been fit tested. The hoods are with Kate, we've got 7 of them, and there's a little fitting video that I've circulated to the students today in years 4 and 5, so that will teach them how to assemble the hoods. So Year 4's, Dr. O'Connor is looking for 15 or 20 of them to help with the interviews for the fifth years on the 20th of November, and I think this little committee are helping me identify those individuals. And we talked about things such as the lectures being good and interesting, and students would love to have them preloaded 24 hours behind, somebody to drive on that. Some feel that they've got enough to do and some not quite enough, and I'm happy with the amount of white space they have because the academic component of fourth year is loaded at the front of the year. We've got a really good series of medicine, surgery lectures, etc. I had 1 or 2 queries about radiology, so I'm going to meet Dr. Sengupta tomorrow just to clarify some points about that, so I can inform years 4 and 5. We talked about the CAT, and that's important because that's a piece of formal coursework. So Dr. Ryan is going to feed back to the students on that. And so of course
you're on the clinic all the time as well, and
yeah.
Not only looking after on the side, you're seeing what the Year 4 are doing on clinics, but also looking after Year 5 and involved with them. So how are things on the clinic? Just reporting on another week being back on clinics.
I think we're slowly progressing. I think every day we meet another issue or problem to solve, and we're very grateful to the nursing staff. I think we've got to be sensitive to the fact that some of our nurses have been redeployed and some of our nurses are sick, so we don't have that safety net of support for students. So I would beseech any student who's going to be treating a patient, please do seek a partner either from your own year or from another year to help and support you, to just make that smooth flow work well. The tutors have been fantastic. One of our tutors this morning actually assisted the student all morning because we were short of a nurse. They had a good teaching experience. So that is coming together a little bit, and there'll be a centralised timetable from the end of the week. Beseech again to the students, please do tidy up. I understand that a couple of surgeries were left untidy last night. So it doesn't do ourselves too much favour. But I've been very impressed by the way that students are treating their patients and being happy to get stuck in there. So we've been taking impressions for crowns and dentures, doing endodontic treatment. So it's actually all up and running. So yeah, it's work in progress, but we're in a good place. And compared to a lot of dental schools who aren't even in treating patients, I think, we're very fortunate to be able to have the opportunity.
All sounds very good. Thank you very much. So I know that our students are doing a fantastic job at the moment, and they're being really professional, really helpful. And obviously it's a learning process for all of us. We're just trying to get used to the new normal. And yes, just a little reminder that when they finish their AGP sessions, it's best that while they still have got all their PP on, they just tidy up the room as much as possible, and then obviously doff the gowns, come out and just get rid of their AGP respirators, etc., etc. So making sure the working environment is as tidy and safe as possible for everybody. I agree with that. Is that right?
Yeah, that's great. Yeah, it will help.
Fantastic. Thank you very much, Alison. It was lovely to see you again. Thanks a lot for accepting my invite to come on Manchester Molars, and I will see you tomorrow at the Dental Hospital.
Okay, pleasure.
Take care.
Good
Bye-bye.
Thank you. Bye then.
Now, a couple of quick reminders. So first of all, the MFT Trust has started COVID testing for asymptomatic clinicians. So if you are a staff member or one of the students on the BDS or BSc programs on the senior years, if you are around at the dental hospital tomorrow, Friday, or upcoming Monday, please just go ahead to the management office, which is on the second floor of the dental hospital, and collect your COVID testing kit. Once you've done that, please just take your sample. You do the test yourself, by the way. Once you've done that, you just take that to the oral medicine, and they will be collecting that from you. Just remember that the shipping deadline on every day is 3 p.m. and they would like those samples to be fresh. So just keep that in mind if you're picking your package for self-testing. And the second is we have started doing AGP testing for our BDS Year 4 and BSc Year 2 student colleagues. So if you haven't done so yet, there is a doodle poll link which you have to click. Make sure when you do that, not only you write down your name, but also your email address and also which year group you belong to, just in case if there's any problem and we have to contact you, we've got the right details to be able to get in touch with you. And the final reminder is that Manchester Molar is also on Instagram. So if you're not following us there yet, make sure next time you go to your Instagram, search for Manchester Molars and come and join us. Now, I'm sure during COVID, we're all doing our best in order to retain and maintain our manual dexterity. I have to confess, I was very impressed to see what Katie, our BDS Year 3 student, is doing in order to maintain her manual dexterity. Please come and join me, and I'm sure you're gonna be absolutely mesmerized. Until next Thursday, I've been Reza Roudsari. You've been amazing. Katie, they're all yours.